The shocking reality behind a common painkiller is laid bare in these distressing photos, revealing how ibuprofen's dangers can escalate into a life-threatening condition. After giving birth to her third child, Jackson, through a C-section, Aleshia Rogers regularly took ibuprofen twice daily to manage her pain. But what happened next was nothing short of horrifying. Within just 3 weeks postpartum, her skin began to peel away, and soon afterward, doctors gave her a grim prognosis, only a 5% chance of survival. In August 2020, the 27-year-old mother welcomed her son. However, she soon began to experience flu-like symptoms, including a high fever, a swollen face, and a rash spreading across her chest. She also felt a burning pain when swallowing. Despite seeking medical help twice, Aleshia was initially misdiagnosed with pink eye, conjunctivitis, and scarlet fever. Medical professionals advised her to keep taking ibuprofen to reduce pain and swelling, a standard recommendation, but one that would become tragically consequential. Just hours after her last hospital visit, her condition worsened dramatically. Painful blisters erupted on her face, and her skin began peeling off, making her almost unrecognizable to her family. These disturbing images show her lying in a hospital bed, her body covered in bleeding sores. Doctors identified this as a severe allergic reaction, likely triggered by ibuprofen. Aleshia, who lives in Lincoln, Nebraska, and works as a child and education technician, recalls the terrifying onset. "My eyes swelled up, were bloodshot and burning, and a rash appeared on my chest. I went to AE and was sent home with a pink eye diagnosis. The next day, my entire face was swollen, and my eyes were swollen shut." A follow-up hospital visit resulted in a diagnosis of scarlet fever and another discharge. But the truth was far more severe. Within hours, her blisters had spread over her face and chest. Returning urgently to the hospital, she was diagnosed with Stevens-Johnson syndrome, SJS, a rare and serious immune system disorder. SJS causes widespread inflammation triggered by an adverse reaction to medication. For Aleshia, this escalated into toxic epidermal necrolysis, 10, a more extreme form of SJS, involving extensive skin detachment. Ibuprofen had been my go-to medication for pain relief since I was 14, especially during my period, Aleshia explains. I kept taking it during my recovery and later for flu-like symptoms, so it's devastating to realize my body suddenly rejected it in this catastrophic way. Once symptoms start, there's no way to stop it. The doctors described Aleshia's condition as sloughing, where dead skin peels off in large sheets. Shockingly, 90 to 95% of her skin was lost. Since skin is the body's largest organ, this led to severe complications, including sepsis and multi-organ failure. Her condition was so critical, she was moved to an intensive care burns unit and placed in a medically induced coma for 3 weeks. She underwent extensive procedures including full-body skin removal and grafting, as well as an amniotic membrane transplant to treat damage to her eyes. During this ordeal, her family was given only a 5 to 10% chance that she would survive. A month later, amazingly, Aleshia left the hospital, though with little memory of what had occurred. "I didn't even remember giving birth. My family told me it was touch and go whether I'd make it. It was truly a miracle I survived." No, she urges caution. Aleshia does not want people to fear medications, but rather to be vigilant and informed. It's important to be aware that even common medicines can have rare but devastating side effects. To clarify, Stevens-Johnson syndrome is a severe skin reaction mainly triggered by certain medications such as epilepsy drugs, antibiotics, and anti-inflammatory painkillers like ibuprofen. It was first characterized by Drs. Stevens and Johnson in the early 1900s. Early symptoms mimic the flu, including fever, sore throat, cough, and joint pain, followed days later by an expanding rash that can spread from the chest to the face, limbs, and genitals. The disease also causes blisters and painful sores on mucous membranes like lips, mouth, and eyes. Immediate hospital care is critical. Treatment usually includes hydration, specialized wound care, pain relievers, and medication to control the immune response and prevent infection. Recovery can take weeks or months. Toxic epidermal necrolysis is diagnosed when more than 30% of the skin is affected, often with extensive damage to moist mucous surfaces. Both SJS and TEN are exceedingly rare conditions, with TEN occurring at roughly 1 case per million people annually, and SJS about 1 in 10,000. Even 5 years on, Aleshia continues to face the long-term effects of this devastating illness, but remains committed to spreading awareness. We strongly believe ibuprofen triggered this reaction. Doctors still don't understand why my body suddenly reacted this way. There is no way to prevent it and no treatment once it begins, and there's always a risk it could happen again. This harrowing story raises important questions. How many of us realize that a widely used medication like ibuprofen can cause such life-threatening complications? Should healthcare providers be more cautious when recommending over-the-counter painkillers, especially after surgery? And how can patients be better supported to spot early symptoms before serious damage occurs? Do you agree that this story serves as an urgent wake-up call for us all to be more vigilant with common medicines? Or do you think the risk is so rare that it shouldn't cause concern? Share your thoughts below. Let's discuss the balance between medication benefits and potential dangers.